Good afternoon, everyone, and welcome to NASM Live. I am Prentiss, and I'm here with Wendy Batts and Marty Miller. How are you all doing this afternoon?
Excellent.
Excellent,
All right.
thank you.
And behind the scenes, we have Greg, always keeping it together. He's the tie that binds us. Binds us. He penetrates us. He gives us our superpowers over the internet. So what we're going to talk about today, we're going to talk about upper body exercises, risk versus reward. And oftentimes when I talk about exercises, I tell people that there's really no such thing as a bad exercise, but there's something like there's poor technique, poorly applied, and applied exercises applied unsafely without a plan. So I'm going to give you a little historical reference. I'm going to play your Jane Curtin to you. You guys can be Dan Aykroyd, and we're going to do a little point counterpoint. Okay? So
Sounds good.
Let's talk about, so let's go ahead and dive in and talk about these upper body exercises, what some of the common ones are that we feel they're better options, and let's dispel some of those myths today. Wendy, take us away.
Perfect. Well, so we're going to do upper body today, and then our next webinar, we're going to go over the lower body, and then we also do one on core. So we decided, because there are a lot of exercises out there that oftentimes people are not sure if they should do, or they constantly do, but they start to feel pain and they don't understand why this pain keeps reoccurring. We wanted to take some time and actually go through some of the common exercises that we see or we hear about, or people ask us questions about when they're working out. And so when we talk about risk versus reward, what we want to think about is, we've talked and we emphasize the importance of the 5 kinetic chain checkpoints. And so again, when we're talking about those, it's the feet being pointed straight ahead, the knees in line with the second and third toes, the hips in a neutral position, shoulders in a neutral position, and ears lined up basically in a straight line and neutral as well. So we're looking at the head. And so anytime that you're going to choose an exercise, you want to think, are you in the proper alignment, and can you execute it safely? And I say this all the time, but safely, effectively, and efficiently to get the results that you're trying to achieve. And oftentimes what we see with some of the exercises that we're going to discuss is that you may be targeting that one particular muscle, but you also may be destroying either the stabilizers or some of the surrounding joints. And so that's why we want to kind of open up your eyes a little bit to think about, hey, this isn't a bad exercise, as you said, but is there something that is safer? And so when we say, is there a safer alternative, we want to discuss some possible, exercises that you could do instead of, whatever it is that we discuss, just for the safety of it, even though you're going to get the same outcome, which is targeting the muscle or prime mover that you want to focus on. And then again, the question that we always are going to ask if someone says, is this a good exercise? The big question that we get with that is, well, I don't know, is it? What's the assessment results? And what is the end goal for that exercise, as well as for your clients? Because again, there are many times that people come in with shoulder problems, and then we do some of these exercises that are going to create more impingement or more pain in the shoulder. So then why would we do it? And so we just kind of want to open up your mind. We're not saying, and I want to emphasize this from the very beginning, that you cannot do these exercises. We're not saying that. We are not saying that. We're just saying these are more of a high risk exercise based on positioning, and there could be some safer alternatives to get the same muscle to fire the way that you're hoping to get it to fire with what may be a higher risk exercise.
So let me ask a couple of questions based off of that, and I think the answer is really right here in this slide, but I want you to elaborate on that a little more. So when we talk about the 5 kinetic chain checkpoints and the muscle imbalances that are driving these compensations, once we address those compensations, and I think you mentioned it, but are these particular exercises that we're going to get into, off the table forever, or can we bring them back in where it makes sense?
Well, the answer to that is yes and no. And again,
it depends.
It depends. That's always the safest answer. But I mean, we're going to show you, like, and we have some, pictures of people performing the exercises. And so oftentimes when you're doing it, you really aren't taking 2 steps back and really thinking about positioning. For example, the first one we're going to discuss, when you see the positioning of the humeral head in the shoulder capsule, it is not safe. And so, in order to try to target and pinpoint muscles, if it's an exercise that could put the joint at risk, then why would you do it? And so, and when you ask me that question, I would say, you know what, I would prefer you not do it, but do this instead, because it's safer biomechanically, because of the positioning that you have to be in order to execute that particular exercise. However, if there is something that somebody just has to do and they love it and it's in their workout, like there is one exercise that, people are going to be like, well, why is this a risk versus reward? Because you see multiple people do it and it's for cosmetic reasons of why they choose to do that exercise. It is a great exercise to do when people need to activate a particular muscle. And so, that's why we wanted to take some exercises that we commonly see people do that are at a high risk, and some that, just consider why you're doing it, because oftentimes people are super overactive in certain regions of their body that we want to take 2 steps back and say, hey, in order to really gain that cosmetic look, take 2 steps back, activate some other muscles, get good positioning, and then add that into your program.
Okay, and I'm still going to dig in, Wendy. I'm like a tick.
Oh, great.
In Georgia in the summertime.
Fantastic.
But seriously, taking it away from aesthetics, and we know that people do some of the movements that you're going to show later on in the deck for aesthetic reasons. But one thing that I wanted to ask is, what about if some of the movements we do that potentially are unsafe if you program them incorrectly, what if they are derivatives? And I think you guys know what I'm talking about. It's coming up in the next slide, it looks like. But, or no, in the next couple of slides. But what if it's a derivative for another movement? If it is a part of a larger global movement pattern, do we take that? Can we consider doing some of these movements that may be unsafe at face value?
Well, I think, it's hard to answer that question because, again, I would never put a client in an unsafe environment ever. And so if there is an alternative that I could do that would get the same outcome, then I should say go down that path and that road versus, let's try it out and see if later on we end up having issues. However, there are some movement patterns that, yes, when we get to one of the second to the last one that we cover, it is part of our movement. And if you are going to do like overhead presses and stuff like that, some of these muscles are going to be involved. So you're just targeting them in a different way. Okay. And Marty, I don't know if you want to add on to that.
No, when we get through each exercise, we'll give the rationale behind, why we singled it out for conversation today, but also talk about, how to progress it, regress it, or give safer alternatives. Because some of these exercises have just been around because they've just been around and they've never really been questioned from a biomechanical standpoint. So it's one of those things where it's a standard in the industry and it's like, God forbid if we threw it away. Doesn't mean we have to, but at least understand what the risk to reward benefit is, or again, some of that gym science, like, oh, I didn't even realize that was occurring. This is so much safer and I get as much enjoyment or better from it. And there's less stress on the orthopedic structure. So those are the kind of conversations we want to have. And then again, if it's necessary, how can you, program it without overtraining it and maybe build up the accessory muscles or their proper range of motion. So that way you have a lesser chance if you're using a higher risk exercise.
And we would also think about the weight too, Prentiss, because again, some of these exercises, people lift a very, very heavy load. And it's like, okay, if you want to do activation, then maybe go back and think about corrective exercise. We do 12 to 20 reps at a lower intensity to try to get one particular muscle to fire. And then at that point, if you're going to load it heavy, you know that you're going to have, as Marty said, you're going to have the entire complex to help it out.
Yeah, absolutely. And I think please don't gloss over that point. And what we're saying is that there may be better exercises depending on the goal, but if you choose to do any one of the exercises that Marty and Wendy that they've outlined, there's a progression for that. There's a process to build up the prime movers and the stabilizer muscles so that you can support that type of training. And with that, I am not going to talk anymore, and we can move forward.
So the first exercise that we'll talk about, and I know so many people love these, are dips. Okay, and we're not just talking about the dips like this guy's doing, but we're also talking when you get the big belt around and you put a huge weight on it, even and then you're throwing that up because it looks really cool at the gym. However, what are you targeting? And obviously we're focusing on the triceps. But just even looking at the picture that we have included, I mean, look at the shoulder capsule and look what's happening at the anterior portion of the shoulder. And Marty, I mean, do you want to kind of go through a little more of the anatomy biomechanics stuff?
Yeah, so this is a conversation I've had countless times at some of our live workshops, and inevitably someone's like, well, what about if I'm doing a dip on a chair, or if I'm doing the dip machine, or a dip is a dip, right? Like if it, what's the saying, Prentiss, if it quacks like a duck, walks like a duck, it's a duck. Yeah. And yeah, so we're not against dips because we have no problem strengthening the triceps, and, obviously there is a chest involvement. But again, we're going to go back to the 5 kinetic chain checkpoints. And when you look primarily at the first joint that we're going to talk about is the shoulder glenohumeral joint. That's a very mobile joint. So when we have joints that are mobile, inevitably we have to give up some stability to have that mobile joint. So you have an anterior shoulder capsule, a posterior shoulder capsule. The anterior shoulder capsule, which is sitting here in the front, which helps you prevent dislocations, amongst other things. It keeps the head of the humerus right where it needs to be to prevent impingements and all these other things. If it gets stretched out and becomes too lax, it doesn't go back. Once you've stretched it, that is, what you're going to have. You're going to have a lax or stretched anterior shoulder capsule. That's why so many people that have shoulder dislocations are highly susceptible to reoccurrences of dislocations because they've changed the structure within their shoulder. The posterior shoulder capsule, on the other hand, is the one that's supposed to have a little more flexibility than what we tend to see in people. See people's shoulder tipping forward because the posterior shoulder capsule can't receive the head of the humerus, and the anterior shoulder capsule has been stretched out. So when you're seeing this gentleman in that position, and again, any dip you want, you end up in this position. Under load, you're driving that head of the humerus into that shoulder capsule and basically forcefully stretching it under load. Yes, you'll work your triceps, and yes, you can get some chest involvement, but we'll talk about other exercises. But then also look where your head position has to go. You have to drive that head forward, which now creates more stress in the cervical spine, changes things at the SC joint, the AC joint. So there's a lot of risk there. And here's the amazing thing about the tricep is the tricep extends the elbow and extends the shoulder. It helps in shoulder tension. That's the only two things it can primarily do. So when people change hand grip positions and do all these variations, the tricep really doesn't care much except did you extend the elbow and did you help extend the shoulder? Those are your primary functions. So there's so many cool ways that we can do this without putting load into that anterior shoulder capsule and allowing the head to come forward. And if you really look at it, if you inverted that gentleman and put his hands, about chest level, it's almost a push-up position. So there again, you can do push-ups. You can do different variations of push-ups, or we can get into all the different traditional tricep exercise we see with the rope and all these other fun things, stability ball, skull crushers, countless different things you can do without putting the stress on that shoulder. Now, if you're in your 20s and 30s, you might be able to do these and be like, hey, it doesn't bother me. Well, I'm 40 and I know a lot of people that are in that generation or higher. And all of a sudden, the years of training and or sports that altered their biomechanics, they start to feel it later on. So we're not saying that you have to feel it right now when you're doing it. Just understand the load and stress that you're putting onto your structure, this primarily being your cervical spine and definitely your anterior shoulder capsule. What gain? That's just a question you have to have. And if you feel comfortable with it, then obviously you're going to try to get as much flexibility in the pec, as much stabilization in the cervical spine, limit your range of motion. But even under those circumstances, there's more stress on that shoulder joint than other tricep exercises we could choose.
And to piggyback off of that, think about too that a lot of the individuals that come into your gym and you do the assessments, they usually have internal rotation just based on life. And so you're also feeding into a very common compensation by even doing this. Plus, I mean, this gentleman is doing it with his entire body weight. So that is a lot of weight that he's also putting on the stress of that shoulder capsule, as well as, activating the tris. So there are, as Marty said, so many different alternatives that they could do in order to target the same muscle.
Okay, so let me give you a couple of use cases, because I have a feeling we've been at this for several months. I'm starting to know our audience. And audience, you can call me out on that if I'm wrong. The specific use case, and Marty, you talked about this often, is that we train movements. We don't necessarily train muscles, and taking it away from the aesthetics that you can potentially get big triceps or whatever from doing the dip. But what about, how would you program this, knowing that take someone in the military who's responsible for PT running their own course and getting a time, and then especially with the popularity of events like Spartan Race and Tough Mudder, where one does find themselves often in this position. You think over a 13-mile half marathon distance. Yep. So how do you program that activity when they're going to be in a compromised position? How do you work with that, maintain stability?
Yeah, going back to what you talked about two sports and then a very unique job, which is the military, which, let's just be honest, boot camps weren't designed for biomechanical safety. It was designed, can I break you down mentally and physically and see if you'll quit under pressure? So very unique compared to just generalized fitness, which if we're doing generalized fitness, I'm definitely going to I won't put dips into the program. If we go into someone who has to do them, I look at it one of two ways. If they're doing it all the time anyways in their normal job or the activity, like let's say you're training a gymnast, I'm not going to overload that pattern more the days they're with me in the gym. I'm going to unload that pattern because they're getting enough of it. If I'm dealing with somebody who's trained with me for 6 to 8 weeks and they're ready for that Tough Mudder and they haven't done dips because I've kept them off it, yeah, going towards that competition, if dips are going to be involved, I do have to allow them to be there. But remember, I now walk that fine line of training them. Now moving into a sport, there's a little more of an inherent risk where you could have an injury, but I do have to introduce that to them. But the whole time I was creating their plan, I was working on their overall upper body strength so they will be good at dips. I've increased the flexibility of their chest and the range of motion that is going to be required. So when they get ready to start training with the dips, all of a sudden now it's not like, hey, wait a minute, I don't have the range of motion. I don't know how to control this. So it's a gradual buildup with other parts of exercises I do. Then we'll peak for that certain amount of time. They go compete. And then if they're not competing again for a while, I'm going to get away from that movement pattern again. So again, there's not an exact way to do it. You'd have to take each person into account, but I don't ignore it, but I also don't overtrain it if it's something they're already putting in their program in an activity.
Yeah, perfect. You just have to you need to live in your sport. You can get adequately strong, and I think that's the purpose of this webinar. It could be wrong, but you can get adequately strong taking yourself out of the movements of the sport and training around those movement patterns that are often overloaded. Yep. Outstanding, and I hope everyone was able to get that. There was a lot of information wrapped up in Marty's statement. So if you have questions, please fire them to Greg, the man behind the curtain, and we'll get those in for you. So are we ready to move on?
Yes.
All right.
So the next exercise that we chose, we were staying again with the triceps, and we're not trying to pick on the triceps, but we thought because we just discussed them, we could throw this in as well, because we see this very often. And again, people call them all different things. In this particular example, we just called it a behind the head single dumbbell tricep extension. Some people call them a single dumbbell, head skull crusher. And think about the name of that and where it got its name. It's because if you were going to do this in the proper 5 kinetic chain checkpoints, you would end up knocking yourself out on the top of the head. And so you want to think too, as you look at this example, there are some safer alternatives. And, what is the positioning that's happening now? He's going to have to move his head forward. He's also putting his shoulders in a closed pack position, so as far back as he can get them, which is supposed to be, it's the most taut, the ligaments in the shoulder capsule, but it's also, you want to think about, you're just going to increase, you're going to decrease impingement too if you have an anterior, if you're internally rotated, think about what's happening. And then now I'm asking you to take this huge weight behind your head and think about what's happening in the struggle that's going on in the shoulder capsule, just again, to get the triceps to work. So, that's one of the reasons we brought this to the forefront is because, a safer alternative is just to do it single arm, just take one and do it one at a time. You're still doing the exact same motion. However, you can maintain the proper alignment and you can still execute it. But instead of just one gigantic heavy weight behind your head, why don't you just take it a little bit lighter and do them single arm, and you're still going to have the same benefit doing the same thing with a slight twist.
Mm-hmm. Okay. Marty, do you have anything? I have nothing.
Sure. No. So when you look, especially, I'll speak to males. The odds of the males having the range of motion in their pecs, their lats, external rotation, it's statistically very, very few people will have that ability. And we're not even talking about that you have to move your head forward. And I've seen a lot of people say, "Oh, look, I can get my arm in that position." I'm like, yeah, but at what cost? You're arching your back, your rib cage is flaring, all of these other things. So, again, it's the risk to reward. So one of the exercises that I think is underutilized, especially by men in the gym, is a kickback. And I like it because remember how I talked about the tricep will help extend the shoulder. So now what I can do is I can pitch forward a little bit, get into a good shoulder retracted position, neutral spine as I lean forward, and then I do that kickback. I'm fighting gravity. I got to really work on all those scapular muscles to keep myself in the right position. Yeah, the weight's going to be a little bit lower, but your tricep will be working unbelievably because not only are you getting that extension, it's at the elbow, you're getting that extension of the shoulder, all of those things that we like to call about accidental exercise with all those muscles in the scapula doing that retraction, depression. Core exercise, you get huge bang for your buck, where this one, it's kind of the opposite. You're going to hit your triceps, but you're putting a ton of stress. And when you think of that downward pressure into the cervical spine and knowing your spine's not neutral, long term, think about what you're doing to the, your neck and as a structural point.
Yep. And Marty, one of the exercises that I love that I also unfortunately see done incorrectly, and I'm sure you do as well, is if people are focusing on the triceps, like you use the kickback as an example. One of my favorites is to use, if I'm not doing a single arm, but I want to grab the rope, the 2 rope that has the balls on the end, is if you take it, people will go straight down. So they internally rotate and then they bring it to their quads. When think about what you just said, that the triceps are supposed to extend the elbow as well as the shoulder. So you're not getting any shoulder extension whatsoever. And again, that shoulder extension isn't to the extremes, but you have to think about positioning. And so if you were to use that one particular, very commonly used rope for tricep extensions, if you pull them apart and work your external rotators in your shoulder, that's one. And then you go down and go into elbow, tricep extension and shoulder extension, you're really maximizing the full potential of what the triceps do for a prime movement. So you're really going to execute that exercise, I think, tenfold, especially over something like this.
Correct. And we're going to get into upper trap in a little bit. But the other thing, whenever I'm teaching it or using the triceps like that rope, is to me, it's not as much of a tricep exercise as it's an anti-shoulder elevation exercise, right? because you see people that so much weight that their shoulders are going this way. Yes, extending your arm, but again, at what cost? And are you really as strong as you think you are if you can't keep yourself in that nice postural position without the head coming? So to me, it's a natural exercise. We do a traditional extension with like the rope or something like that. Absolutely.
The old crunch with the elbow extension.
That's right.
I love it.
So then you're actually move away from Prentiss unless you have that you have.
I know that triceps are responsible for the for elbow extension, but one that I like to do as well from our CS tech is to have that to do that exercise with a little shoulder flexion to put more, just to stress that elbow extension a little bit more. But other than that, no, these were all perfect exercises. And we do have a question from Carrie Jean. Carrie, I don't know, this is a question. This is both a statement and a question. And Carrie says, we are terrible about stretching. Says, oh my God, I was about to say I prefer kickbacks. How about, this is going back to a previous slide. What about body weight bench dips? I think you answered that already, Wendy, but let's go back and revisit the dip.
So the answer is, what is the risk versus reward? And I would tell you not to do dips because, again, it's just not worth it. And again, as a personal story, when I worked in baseball, I worked with professional athletes, and we had a pitcher that really loved and swore by dips. He felt like that was something that was actually helping his power output. And we kept telling him, like, it's really not good because think of all of the movement that he has to do in his shoulder and just the wear and the beat down he puts on that particular joint throughout his career. So every single day. And he was in the gym, not working with me, but he chose to do dips on his own. And he actually, he went down into a dip. Humeral head came out the front of his shoulder and ruined his career. And he was a 40-man player, which means he was one of the top players on that team. And so that's why I say just be very, very careful. I mean, we're not telling you not to do them. However, I would tell you, I think there's a better alternative. As Marty said, I love kickbacks, doing tricep extensions, laying on the bench or a ball. So skull crushers, but independently, one like a weight in each hand. I think there's way more, safer alternatives than just doing a dip if you can let it go.
And I'll add to that. You can get and Marty, you should go to the mountaintop and scream this. You can get a lot of miles out of push-ups. Oh. I've not seen a case where a muscle group could not have been benefited by push-ups. You have a lot of variations to go through before you exhaust, and I think you just need to explore that. You try not need to. You're going to do what works for your clients and yourself, of course, but you have a lot of progressions to go before you exhaust the push-up.
Mm-hmm.
Yep. So hopefully we answered that question. If not, feel free to type some more out, and we'll go through whatever we need to in order to hopefully help answer the question further if we need to. But the next one we were going to talk about, and this is going to upset some people I know, is the upright row. And Marty, I'm going to let you take this one.
So I'm gonna go right back to my athletic training days. That's my first part of my career, and still a certified athletic trainer. So we are there to assess injury and to make sure that people can continue to participate, or do we need to pull them out of that activity? And so we do a lot with the orthopedic type of injuries. So one of the first things we learn in shoulder assessments is impingement, and there's special tests. There's a bunch of special tests for the shoulder that test different things. But one of the ones that we learn right away is an impingement test, where we basically mirror an upright row position. So what we're doing is we're doing internal rotation, more on the impingement test than you see here, but we're driving it across their body to take the humeral head and just smash it into all the structures inside the shoulder to see, and that's not under load, that's just body weight, to see if that causes a symptom and recreates the pain. If that is positive, among other things, you can start to assess that you have a shoulder impingement. So shoulder impingement is basically, there's a bit more to it than this, but you've got 4 structures that can be impinged. You've got your subscapularis, which isn't the most common, but you've got the long head of your bicep tendon, and then your supraspinatus and teres minor and infraspinatus that sit between these major bones. So your humeral head and then your acromion. And as they pass through there, there's just a little bit of space that needs to be maintained there at all time. If that space is ever, compromised, you're taking these little tendons and a bursa that's also in there, and you're squeezing it between 2 hard structures of bone. That's where the impingement comes from. So what I tend to see when people do upright rows a lot or some other exercises, as soon as they let the weight down, they give it one of these things. And they're like, you just tested yourself under load for shoulder impingement. And then people keep going and doing it. And when you look at the position here, they're also shooting their head forward. So now we've changed the biomechanics once again of that whole complex of the neck, the shoulder. So when most people are doing upright rows for upper trap, which we're going to talk about, or lateral delt. Not opposed to working lateral delt by any means, and we will talk about upper trap here shortly, so I'll leave that over here. But there are safer ways to load the lateral delt without maximizing that shoulder impingement situation. So again, not saying never to do it, because Prentiss, I have a feeling you're going to throw this curveball at me. What if I'm dealing with athletes that have to do snatches and overhead things? Again, similar to my other conversation about dips, is I will phase it in when appropriate, look at what the end outcome may need to be, and I might do things like kettlebells or other things. I may not load it in this really tight position with a lot of weight, because if you're going over your head, at that point, you better be using your hips and your core to get that bar over your head. So again, it's one of those exercises that I can't say I utilize ever, me personally. But if you are going to utilize it, if you're feeling that pain afterwards, that's an indication of maybe that's not the right exercise for you. But also, again, what's your long-term goals? And are there safer versions to attack the shoulder complex? So another long answer, but I'm sorry.
And Marty, to also, when you were saying the different positions, a lot of times people will say that they'll go into the empty can test, which what that means is another test to see if you have a torn rotator cuff. And we see this often in the gym as well, kind of targeting the same muscles. It's a lighter weight, they claim, even though they're still using a lot of momentum head and throwing it up. Because, these are really small muscles that you want to think about. They're protecting the shoulder capsule. But if you do it with your thumbs pointed down, you're internally rotating, and then you're lifting with momentum and lifting a heavy load. Well, again, just doing that thumbs down and lifting up is a test to an orthopedics, or a specialized medical professional to determine if an area is torn or injured. So why would you want to train that way? So as a safer alternative, turn your thumbs up and do it that way. Lighten the load, do it under control, make sure that you quote own it, because you're going to get more activation that way versus using momentum to lift heavy for something that you can actually increase the risks up. Like you're increasing your risk of tears and injury.
Right. And just want to jump in there really quickly. And Marty, please correct me. And before I jump into that, thank you for stealing my thunder. That's exactly what I was going to ask you. I will get over it by the time we finish this webinar today.
That's okay.
But this for everyone listening. The orthopedic tests they're designed to be provocative, meaning they're designed to elicit that symptom that you're going into your healthcare provider for. So we don't necessarily want to strengthen that pattern. And I think that's what we want to get to. There's safer ways within our anatomical position that we can strengthen these movement patterns. It's not by using a provocative test.
Correct.
Okay, that's all I have since Marty asked the Olympic weightlifting question. I guess we can continue.
All right. So the next one that we're going to discuss is the shrug. And again, so I'm going to say something before I'm going to ask Marty to take the floor on this one as well, because this is one that he wanted to include. I mean, shrugs, you can do them. So we're not saying that you should take shrugs out of your entire workout. However, we are going to go over the specifics reasons of why you just want to be careful when you do a shrug. So Marty, what would you say to that?
Yes. So now remember, a lot of these exercises that we're talking about tend to be in the higher levels of the model, first of all. So again, day one, somebody coming in with deconditioned or have never really been through the OPT model that have faulty movement patterns, you're going to see an increased chance of issues with a lot of these exercises. We did talk about some that maybe we don't want you to do, or we limit. A shrug can be a good exercise, but more than likely day one is probably not the best thing to get after. You're going to see a lot of people are guarded or they tense up and they have an elevated position of their shoulder. So at that point, they're already telling you that they don't need strength in that. They need to learn how to relax it. Maybe it's just a cueing issue. But again, if they always are firing that whenever you see them do a push or a pull, even at the lowest levels of weight, watch what happens to their scapula. You'll see a lot of people elevate. And this goes for people that are sitting at the desk and all these other type of positions. Now, assuming we got people through a progression, then shrugs can be okay. So, there's the upper trap, which is the general thing that we're targeting in a shrug. However, if you're doing it properly, you will have the chin retracted, which is now aligning my spine properly. And again, I will have a slightly retracted position, and I'm going to come up under control, pause, and go all the way down under control at a much slower tempo than what you see. I almost see ballistic shrugs in the gym. And I also see every time they shrug, their head pops forward. I always call that like the Pez dispenser, where their head comes flying forward. So once again, I've talked about it a couple times. Think of all that stress in the cervical spine. So these are the type of things that we need to be careful of. Now, the trap complex can do a lot more than most people think it can do. It laterally rotates, elevates and retracts the scapula. And if the scapula is fixed, it can do some rotation and movement of the head and neck. So we're not saying never to do shrugs, but it's not dealing with football players, wrestlers, mixed martial artists that really big, thick, powerful muscles around their neck to guard it from impact. Probably not using a lot of weight with the people that I would eventually bring shrugs into. And they have to do it with that chin tuck position, slight retraction, that ideal posture, and it's going to be slower and controlled by far than what you would see in the gym. And again, this is not something that I'm usually firing off right away unless it's a total corrective exercise type of candidate and they've got some unique things that are going on in their scapula. But again, we're talking the weight would be so minimal at that point. So I'm kind of surmising the majority of shrugs we're seeing are in the gym with heavy dumbbells or the heavy barbell.
And just to when you say the barbell, that's the one that I see where it causes some of the risk versus reward. Because again, if you have a straight bar and it's loaded very, very heavily and you are going straight, most of the times, as you can see, even in this individual in this picture, when she goes up into her shrugs, look at what's happening at her shoulder complex. So she's actually internally rotated to hold the bar out. So she's not literally being able to keep her shoulders back and maintain the proper alignment while she's actually going through the motion. So just be careful, like you said. I mean, we're not saying not to do them. There is a time and place, but just make sure that they're in really good alignment, that it's safe, and that, as Marty, you mentioned multiple times, under control, and that they need it. So that's the big.
And I'll add to that, and you brought up a good point a couple of slides ago. Similar to that for our Tough Mudder people, you have to consider we're working with office workers and people who are chronically stressed, and one of those reflexes is to shrug and internally rotate. So we don't want to then turn around and take that exercise and add that movement pattern onto an already compromised posture.
Yeah. And Prentiss, to go off that, a thing that you just kind of cued me to think about, a way that I use something similar is I do a lot of carries because I can, again, get the right weight. I can get dumbbells. So now I'm a little more externally rotated or neutral. I can get them to get set And yes, they are going to be using their upper trap to stabilize, but I don't have them walk around in the carry position elevated most times, unless, again, very sport specific. But there's nothing wrong with doing arm carries or 2-arm carries. But again, I'm not elevated as I'm carried. I'm retracted, chin tucked. And of course, I'm strengthening my upper trap because it's preventing movement. And of course, it's helping carry that load. It's just I'm not always doing that shoulder elevation portion. So It's another way to kind of attack it without forcing that elevation.
Perfect. Okay. So are we ready to get to,
we're moving along.
Yeah, we're going to move along. This one, I'm not going to touch.
I'm ready.
I don't do them. I don't do them personally, but I'm not going to touch it.
Wendy with the grunt.
Yeah, well, of course, we wanted to add in the behind the neck lat pull down. And as you can see, this gentleman is not in the 5 kinetic chain checkpoints. And, I did mention the closed position. And, we say that you're thinking about what's happening at the shoulder muscle, and the ligaments in that position are the most hot. They're stable, but that's also where you don't want to crank a lot of weight on because of the what can happen to the shoulder capsule in that position. So there's really not a benefit going into that particular in the neck, but it does cause a lot of on the shoulders as well as the neck because you have to move your head again out of the way. Now, we are not saying not to perform lats. We are not saying that any type of pull down for lats is bad because, again, you can do individualized cables. You can actually use a bar, slightly lean back, still maintaining proper alignment of the spine, drawing in the core, and then driving down and having the bar come right around your sternum. I think it's a fantastic exercise. It just allows you to maintain proper alignment, and it also keeps the joint in a very, very safe position. And Marty, I don't know if you want to add into that.
What I like about the variation between the behind the neck and the front, let's assume that there was no problem with the behind the neck. You're going to have less range of motion. Where in the front, you're going to get more of that shoulder depression and retraction. So you're actually even gaining more from that added range of motion with what we need the scapula to do. So when we add that on top, that's where it's just hard for me to do a behind the neck. I don't personally do them. I don't train people to do them, just due to the fact that I love the extra range of motion and the safety of what's going on in the shoulder and the neck.
And before we continue along that line, Natalie has a question. And thank you, Natalie, for jumping on and spending your time with us today. And also, before I forget, Carrie, thank you for submitting your question and for being on today. Natalie wants to know if we could go back to the shrugs. What are some safe? Marty, you mentioned a couple with the carries and definitely holding dumbbells. But what are some other safe alternatives for shrugs?
Gotcha. I personally like to do any type of shrug standing. I know there's the seated shrug type of machines. Not a big fan because I've taken out my core. To me personally, it's a little harder to keep somebody in a neutral spine position, and I want their glutes engaged at all time. And if I'm carrying over to real life activity, more than likely in real life, I'm going to be using my legs and other body parts as I would ever have to pick up any forceful weight. So for me, I stay away from the seated, even if I was going to sit and do dumbbells. So I love the carries. I absolutely love them. Or if I can't do a carry, I have no problem, but I will personally always use dumbbells because of the points that Wendy made. And I will do them without wraps. Prentiss, you and I grew up in the powerlifting days where you'd strap, for the pull downs, everything. You really lose that grip. And we know that there's a huge correlation between shoulder stability and grip strength. So I actually do my shrugs when I am doing them slower because I really want that time under tension in my grip. So those are just different ways I'll do them. And I like the one-arm carries, so that way I have to really my core. And I've even done like a one-arm type of carry with lunges, where I'll lunge 12 times with the weight in my right hand, 12 times with the weight in my left hand. And again, I'm focusing on the proper position of the lunge, of course, but also what I need to do at my shoulder complex, including my cervical spine and trap and scapula, so that way I can do it, with a little bit of coordination in there as well.
And there's another one that my husband likes to do that he likes when he activates his shoulders instead of lifting heavy, and it's a specific activation of the targeting the same muscles that would target in a shrug, is that he would do like an overhead press, but then add a shrug with that. So therefore, there's not a lot of any pulling down on the shoulder if somebody can't do a farmer carry or a different type of carry, or they don't feel like they're benefiting it because the weight is too much for them to control. That even doing a seated press with a kind of a shrug up at the same time, you could do that as well.
Okay. Great. So hopefully, Natalie, that gives you some alternatives for adding some shrug exercises into your programming. So let's go back, since we're on positioning and alternatives, let's go back to the lat pull down now and talk, just revisit the alternatives that you had talked about. Wendy?
Certainly. So again, they do have like the cable machines where you can grab a cable from each end. You can sit down or you can stand, get yourself in the 5 kinetic chain checkpoints, and then just drive your elbows down and back. That's one of the more common ones that allows you to be in a very, very good, safe position. If you want to use the bar, as I mentioned earlier, you can be in a seated position. If you want to slightly lean back. So again, you're not leaning all the way back, and there's no motion at that point. Once you set your hips and you set your core, you're just actually going down, controlling the bar. So you're not letting it drive you up and pull you off of the seat. That's another one that you can do. There's a ton of there's pullovers that you can do with dumbbells. Marty, I don't know if you have some favorites.
No, I think you kind of hit them all. Those are the ones that I tend to use. And then the only other thing too, I'll do the suspension training, where I'll shorten the suspension training. I'll sit right underneath it, and then you can do pull-ups in that variation as well.
Yep.
Okay. So are there any more? So it looks like we're at the end. So are there any more questions from anyone who's listening with us today? And while we're waiting, Wendy, tell us what your big takeaways are for today.
So the big takeaways that I feel about doing this presentation, and the ones that are going to be coming up in the near future, is think about the safety of your client. A lot of times we really love exercises because we grew up with them, but is it really the safest thing for your client? And I think that's the big thing. When you're designing a program, always keep the client in mind, keep their assessment goals and results in mind, and then design the program that's going to benefit them to be able to fire the prime movers that you really want them to activate throughout the workout, but in the safest manner possible. So the 5 kinetic chain checkpoints, really, make sure that you own the exercise. That can you control it at the tempo that needs to be happening to build the adaptation in the phase that they're in. And then at that point, have fun with it. So if you feel like you want to do a dip and you think that you can do it, and that's something that you want to do, that is all you. We just to provide with some insight and kind of some knowledge about, listen, if you do this, just please keep this in mind of what could happen long term on an injury standpoint. And so, yeah, and if you want to contact me, my information is up there. So it's just wendy.bats@nasm.org. And then my Instagram is wendy.bats13.
All right, awesome. And before we get to Marty, you brought up something really interesting, just about understanding what's good for the client. And Marty, you've talked about before, at some point, if you're going to be in this industry long term, really expand your toolbox. So, but having said that, a lot of trainers' first portal of entry into the fitness industry is through a modality. I know you mentioned TRX, it could be kettlebells, it could be whatever that is. So what's your advice to that person to get them to use that modality, but also keep the client in mind, keep them safe?
Yeah, so interesting. Like I came up with something, that just fixed in my mind. I call my 3 rules of training. Is first, do no harm, which as a medical professional, we have to take that oath. But we just talked about a lot of opportunities here to evaluate what's appropriate. Then you got to give them what they want while you give them what they need. So again, they may have grown up, as Wendy said, or you may have grown up, or these modalities. So think about that, and then change it up as needed, and study more, and understand that NASM's that toolbox where you can fit every modality within the industry when you look at it from a 5 kinetic chain checkpoint standpoint, as well as where in what phase of training and the regressions and regressions. And then the final thing is have fun with it, right? We don't want to make this, painful, not talking about physical, but just the process. So that's kind of how I go through anytime I was training a client or even for myself. So go out and get all those modalities, but don't get confused between a modality and a evidence-based system. Fall in love with that evidence-based system, and then put all those modalities that you love in the proper spot.
Outstanding. Do you have any more takeaways for today, Marty?
No, except just come back next week and we'll go through lower body.
All right. Sounds good.
And then my contact information is right there, marty.miller@nasm.org, and then dr.martymiller2 for Instagram.
All right. Well, thank you very much. And if there are no further questions, thank you, Wendy and Marty, as always, for providing us with this information. And thank you, Greg, for holding it together. And thanks to everyone who stuck with us for the entire hour. We will see you next time.